Hello, my name is Bernadette Guluya, and today I'm going to be talking about analgesics, which are also known as painkillers. So, what exactly are analgesics? Analgesics are drugs that relieve pain, but they don't turn off your nerves or alter consciousness. This is in big contrast to drugs that may be administered during surgeries that do alter consciousness and put you to sleep. These drugs, however, do not affect your nerves or consciousness, and instead, at most, make you a little drowsy. They are also commonly known as painkillers or pain relievers. They are commonly used for treating injuries, acute pain such as headaches, cramps, soreness, chronic pain such as arthritis, and are used during post-surgery care. There are two major groups of analgesics, which are narcotic opioids and anti-inflammatory analgesics. So, how do analgesics work? In the case of anti-inflammatory analgesics, they work by reducing inflammation, also known as swelling, at the site of pain. This works because when there is swelling, there's pressure on the nerves around the site of pain, and when you take an anti-inflammatory analgesic, inflammation is actually reduced, which reduces the swelling and pressure against these nerves, thus reducing pain. Narcotic opioids work in a much different manner. They work by changing the brain's perspective of pain. This is done by the blocking of transmission of pain through the spinal cord or brainstem. This prevents signals from our pain receptors from traveling to the brain and being relayed back as a pain response. So, more on the different types of analgesics. Narcotic opioids are effective against most types of pain, including visceral and somatic pain. They are available only by prescription, and some examples include codeine, fentanyl, hydrocodone, and oxycodone. Anti-inflammatory analgesics, on the other hand, relieve mild to moderate somatic pain. They are available both over-the-counter and by prescription. Some examples of anti-inflammatory analgesics include acetaminophen, over-the-counter NSAIDs, which are non-steroidal anti-inflammatory drugs including aspirin and ibuprofen, and stronger prescription NSAIDs. So there is a big risk when taking narcotic opioids, as all narcotic analgesics are scheduled drugs. This is due to their high abuse potential. They are highly addictive drugs, and by taking too much of it or too often, you can easily become addicted to this drug, which is why they are often used in combination with other and safer drugs to reduce the narcotic side effects while still providing adequate pain relief. Common side effects include sedation, dizziness, nausea, and physical dependence and tolerance. These last two side effects listed are the biggest contributors to its addictiveness, as taking too much of the drug can cause a physical dependence on the drug and actual tolerance of the drug, making it necessary to have higher and higher dosages every time you take the drug. Although NSAIDs don't have an abuse potential at all, there are still big risks and consequences that come when taking these drugs incorrectly. They can cause bleeding in the stomach and digestive tract, also known as peptic ulcer disease, and even normal doses if taken on an empty stomach. If you take these drugs on an empty stomach, you are actually prone to ulcers forming in your stomach because there's no protection from the breakdown of your lining, your intestinal lining. High dosages can also cause serious liver damage and even death. Common side effects include stomach irritation, kidney damage, tinnitus, dizziness, and swelling from fluid retention. Despite these risks and consequences, analgesics are still necessary to relieve pain for comfort and successful recovery after injuries and surgical procedures. It's important to know these risks so you can avoid substance abuse and avoid all of these risks and consequences. Over-the-counter analgesics, although they are over-the-counter and easily obtained, that does not mean they are not dangerous. They should be taken with precaution, and you should always read the labels on all your medications to know how to properly and safely take them. And this is my list of references. Thank you so much for listening, and I really hope you learned something new about analgesics. Thank you.